The demand for bilingual social workers is high in New Jersey. John Ramos from the Department for Children and Families will discuss those opportunities. We discuss with the Guidance Center their commitment to providing mental health services in Cumberland County, and the Anti-Poverty Network is helping to turn the tide on poverty in New Jersey. It's all here on the next Latino Motion. Join us.
Choose quality, value, distinction. Choose Stockton.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University. Funding for Latino Motion is provided by Atlanticare, healthcare you can believe in. Atlantic City Electric, energy for a changing world. And South Jersey Gas. Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. All across the state of New Jersey, the demand for human services is extremely high, more so for those with bilingual skills. And if you happen to be bilingual or know someone who is, we have some important information to share. Joining me is John Ramos. He is with the New Jersey Department of Children and Families. John, welcome to Latino Motion.
Thank you, Bert.
So there's a demand for social workers, and obviously we're in a university here that offers those type of programs, but tell me a little bit about what the demand is for social workers in your agency.
So currently the department is looking for social workers who have a background in, a degree in social work. We prefer a degree, a bachelor's of social work or a master's of social work. However, we also are recruiting students who have a related degree, similar to psychology or those social services. And we're really trying to empower our workforce to have workers who are bilingual in Spanish and English to kind of assist our clients.
So let's talk a little bit about the role. What kind of jobs are we talking about?
We're talking about our family service specialist training position, so it's our entry-level position. And basically these workers are charged with responding to or investigating allegations of abuse or neglect in the home, or assessing for child welfare services. These workers are our first responders. They also have specialties. Some of them are, let's say I'd open a case, they would be our permanency workers. So after we open a case and are providing services to the families and children, they would be the one who kind of monitors the case. We also have adoption workers, resource workers. Resource workers are those who, kind of help us with our resource families. And we also have adolescent workers. Those are, workers who specialize in a caseload of teenagers or 14 to 21, because we do service children up to 21.
So the department itself, the division that you work under, is in charge of protecting children and providing the services to children and families to assure that they have a stable and safe environment as well.
Correct.
Let's talk a little bit about what the requirements are. So you mentioned quite a number of opportunities, career opportunities, and certainly a great entry-level type positions that are available for those who want to get into this kind of work, and quite frankly, even work within the community. So it's a real good hands-on experience. What is required by way of education and so forth?
So education-wise, it would be a 4-year degree. The preferred degree would be a bachelor's of social work or a master's of social work. However, we do have related degrees. So for people who may be majored in psychology, for instance, or social sciences, they could also apply. If they have 6 months experience, that would assist them. And once you're hired, you get training.
The employer is the state of New Jersey, which has some pretty good benefits. Can you tell me a little bit about what kind of salaries and what some of the benefits are?
Sure. Our family service specialist trainee, which is the actual title, with the bilingual in Spanish and English variant, the starting salary is $49,000. After 6 months, they will get an increase to $51,000, and then after the year, they will get an increase to $53,000.
So that's pretty good pay coming out of college and being able to go into that kind of entry position.
Correct. It's a competitive salary for the field. And they also get benefits, medical. We get paid time off, of course, vacation, sick days, personal days.
Can you walk me through a little bit about what the responsibilities are? And I think you kind of alluded to some of that, but just opening up a case or doing the first line, if you will, in terms of approaching a family that's been referred to the agency. What does it involve?
Sure. So we get referrals at our child abuse hotline, and they're screened. After a call is screened, it's assessed, and it's sent to a local office where we have workers who are trained to investigate. So if you're a family service specialist trainee, first off, you will get training. So
Right.
the first, 6 months would be on-the-job training. You would go to our professional center and get core courses, and you would gradually assume a caseload. But some of the job requirements that once you successfully complete your training are you would investigate allegations of abuse or neglect. So you will respond to a family's home and investigate an allegation of abuse or neglect. We also do what's called child welfare services. So oftentimes families may, have a crisis or need some intervention or need some linkage to services. So part of your job would also be to conduct what we call a child welfare assessment and kind of link the family to community services or services that are, deemed appropriate for the family.
Yeah, there's often a fear when your agency is called, oh, they're going to take my children away. But very often it's just being able to refer families and provide them the links to needed services. Is that correct?
Yes, correct. Oftentimes people are scared of our agency. However, we, really try to work with people and kind of, meet them where they are in a place where we can work collaboratively together to, assist them.
John, thank you for sharing that information with our audience. And please stay tuned. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. When it comes to mental health, statistics do show that only 36% of Hispanics with depression receive care versus 60% of non-Hispanic. One organization that is helping to eliminate these barriers to treatment is the Guidance Center. And to discuss the services that they offer is Gary Mollers, Director of Community Service, and also Jose Rivera, a member of the Board of Trustees. Gentlemen, welcome to Latino Motion.
Well, thank you.
So that's a little bit of disturbing statistics within the Latino community, that a very small percentage compared to the rest of the community actually go out to seek services. And that's something very important that we have to do a better job of reaching the Latino community. How important is it to get that word out?
For me, it's highly important because in our community, we have a big section of our living area that are Hispanics. And they are kind of shy to go and ask for services and ask for help. That is one of the cultural barriers.
There's cultural barriers that I think there's a little bit of more of a stigma within the Latino community, in the Anglo community. Now, Gary, tell me a little bit about the Guidance Center.
We're a private nonprofit. We have 13 different programs we offer across the county and into parts of Gloucester and Cumberland counties. We serve over 5,000 people a year, and we will work with anybody, some children, but in outpatient and crisis services only. But most of our programs are for adults and for the severely mentally ill affected.
So exactly where are the locations of the services?
Our main office is on Carmel Road in Millville, but we have other outreach offices. Our other outreach outpatient offices on 80 South Main Road in Vineland. The other offices I kind of recognize as being closed offices. If somebody walked in and asked for help, we'd give them a phone number, but they can't actually get services there. It's an outreach post where they provide case managers that go into the community.
You do have a phone number, and we'll put it up, that is actually a hotline. So it's a crisis hotline, so if someone is in crisis, they could actually call that number. And Jose, I'm assuming, is there Spanish speakers as well available in the agency, so those Latinos who want to seek services could get it in Spanish?
Definitely, because one of the things that we try to do is to have our doors open for the Hispanic community. And I have, like, let's say, some kind of personal interest that our center provides services to the Spanish-speaking community. And when we have our meetings, we always try to hire bilingual personnel, like from housekeeping to psychiatrists, because we need to make people comfortable and that they feel that they can speak to someone.
Very good. Let's talk a little bit about the services. Sure. What are the programs?
Well, our main program is the outpatient service, where we have guidance staff, therapeutic staff provide counseling. We have psychiatrists, nurse practitioners who will do medication monitoring.
The outpatient services. So this is where you go. You're going through a depression, or you have anxiety, or some other, or a member of the family. You make an appointment, and you're able to go see a physician there.
Yes, absolutely. We usually start with a therapist who would do the intake and then determine what the needs were, and then make a referral either to the psychiatrist or the nurse practitioners, or another program at the center if that was appropriate.
Believe it or not, within the Latino community, just taking that first step is perhaps the most difficult, not being aware of how the system works. But it's just like a doctor's office.
Yes. Yep. Each of our offices are walk-in. They can sit down. We try to have a Spanish-speaking staff at the desk, so when someone walks in, if they can be able to connect with someone there. And we usually have a Spanish-speaking staff in each of our departments, so that if someone has special needs to communicate, we can accommodate that.
Walk me through the rest of the program. Sorry.
No, it's fine. The main program is outpatient services. Our crisis screening center is there 24/7. Someone can call in and talk if they have a problem, or if it's more severe, they can come in and we can figure out if they need to be in the hospital or not, and develop a good treatment plan for them on discharge. One of our really good programs is our family support service. We work with the family members to help educate them about what they can do to help their mentally ill loved one. That's been very successful, because a lot of times people don't know what to do or how to work. They have a support group attached to it. And another program that we mentioned kind of a little bit earlier was a jail reentry program. And it's a funny name for the program, but the idea of it is that we have case managers go into the jail, the county jail, and they will work with individuals so that prepare them for discharge once they get out. So hopefully they don't have to recycle through that pattern and wind up incarcerated again.
It's very important to have the support for the families who have certainly a family member who's going through a mental health crisis or need medical assistance. So certainly having the support is very important. And Jose, I'm assuming that it's also available in Spanish?
Yeah, definitely. Because one of the most important things in the Hispanic community, it is the family, because the family is the central unit of our culture. So for us, it is a big step to get the whole family involved in the process.
And I know you've been reaching out to the Latino community, to the radio station there in Vineland as well?
Yes, and thanks God we have a Hispanic station in Vineland that covers our area. And more than once, we have people from the center, from the different programs, and we get them to the radio station on Saturdays. They explain the facilities and how they can reach us, because for me, that's a very important component.
And we also have an event that's coming up as well. So it's a fundraising event for the organization.
Yes.
And we'll put it up. Fortunately, we don't have a lot of time to go into it, but we'll put that flyer up on the screen as well. But thank you for sharing this information with our audience. And please stay tuned. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. While New Jersey's official poverty rate is lower than the national rate, poverty in New Jersey continues to rise. The Anti-Poverty Network is helping to make a difference for families here in New Jersey. And joining me is Renee Cubiatis. She is the executive director of that organization. Welcome to Latino Motion, Renee.
Thank you, Bert. Good to be here.
Let's talk a little bit about the status, if you will, of poverty in New Jersey.
Sure. So the official poverty rate, which goes by the federal poverty level, which is calculated by the federal government, has risen from 8.6% in 2007, right before the Great Recession, to 11.1% in 2014. However, the true poverty level includes working poor, people who are not able to meet all of their basic necessities for themselves and their families to survive.
We're certainly seeing a big impact here in South Jersey with a lot of the closures that we're seeing, particularly with some of the casinos.
Absolutely, and Atlantic County has the highest foreclosure rate in the nation right now, unfortunately, because of those closures. But in terms of including the working poor, people who just aren't able to meet all of their basic necessities, the poverty rate here in New Jersey between 2007 and 2014 increased from 21% to 25%.
So that's significant.
That's a quarter of our population here in this state.
Now, it's not only the adults, but we're seeing more and more of the youth living in poverty.
Yes, absolutely. Too many children live in extreme poverty here in New Jersey as well, with family incomes less than half of the federal poverty level. So that would be about $10,000 for a family of three.
So let's talk a little bit about what your organization is doing to help prevent poverty to begin with and to kind of turn the tide, if you will.
Sure. So the Anti-Poverty Network has been around since 1999, founded by a number of great advocates in our state around poverty issues. And we were formally became a 501c3 about 3 years ago. But this has always been a great organization, pulling lots of wonderful people and advocates and people with lived experience of poverty, people from the faith community, all kinds of people interested in helping to eradicate poverty in our state together to create change and push for policy change at the state level.
I know that advocacy is a big component of what you do, trying to get laws and engage individuals to make changes. Tell me a little bit about those efforts.
Sure. So earlier this year, we joined with New Jersey Policy Perspective and advocates from the Lutheran Episcopal Advocacy Ministry and New Jersey Catholic Conference to push for an increase in the benefit level for TANF, which is the cash benefit under welfare. And this benefit level has not been increased since 1987. That's 29 years ago. That was the year my family actually was leaving welfare in Camden County. And that benefit level at the time was not enough for my family of three, my mother and my brother and I, to survive on. And so with the great increases in housing and food costs and all of our other cost of living increases that we've seen, especially in a really high housing market state and renting state like New Jersey, I don't know how people can actually survive on $424 a month.
So you also have a checklist of things that could really help to turn the tide on poverty. Tell me a little bit about that list.
Sure. So APN did a report released in May called The Cost of Poverty Statewide, with 3 cities that aren't typically thought of as high poverty areas. People usually think Camden, Newark, or even Atlantic City, but we focused on Bridgeton, Passaic, Perth Amboy, and Trenton. And it was produced by the John Watson Institute at Thomas Edison State University. And it really highlighted a number of things that forced poverty into all of our urban areas across the state, both small and large, over the past 40 years especially. And so there's a concentrated poverty in those areas with the greatest need, but yet the least amount of taxes and municipal aid and other resources to deal with that need. And so some things that will really help and benefit people in poverty is increasing the earned income tax credit, which is really an amazing tool to help people who are working poor to move out of poverty.
On the federal level.
No, but the state actually can increase their share, which Governor Christie did last year. He increased it to 30% of the federal level, and if we increased it to 40%, so 30% actually benefited an additional 500,000 families, 500,000 people in this state. If we were to increase it to 40% of the federal level, it would help an additional 600,000 families to move out of poverty, which is a huge help.
Obviously, the rate of pay is also another issue.
Absolutely. We work with allies on increasing the minimum wage because I mentioned working poor exist in our state, and it's a huge number of people. I always say working poor are 2 words that should never be heard in the richest nation in the world. If you're working, you should be able to afford the basic necessities for yourself and your family. But some of the other things that can really help is increasing SNAP benefits, which is formerly food stamps, really dramatically increasing the number of affordable housing units in our state, because that has not been done significantly over the years, right? Even since the Mount Laurel decisions in the early 80s and the establishment of the Council on Affordable Housing, we have not had the amount of affordable housing that we truly need in the state.
Before you complete your list, we're running against the clock here. Let's talk about your initiative. You have a summit that's coming up on October the 28th. Tell me a little bit about that summit.
Sure. We have an annual poverty summit that we do, but this year we've been working with really great folks around the state to develop a structural Structural Racism and Poverty report to focus in on all the different areas of policy issues within poverty and how to change those things. And so that will be the focus of our Poverty Summit this year, with workshops, with keynote speakers, and with panel discussions on how we can move forward and really address the issues of structural racism, not blatant racism, but the racism that we see in our everyday lives but don't always recognize, right?
We'll put up that information on screen. So October the 28th, and it's Middlesex Community College, and we'll also we have a website that people could go and get information, as well as an email address. Thank you so much for sharing this information. We look forward to having you back in the future. And thank you for joining us at home once again here on Latino Motion.
Choose quality, value, distinction. Choose Stockton.
Funding for Latino Motion is provided by Atlanticare, healthcare you can believe in. Atlantic City Electric, energy for a changing world. And South Jersey Gas.